When we have cranial disorganization or a cranial injury complex, as I've discussed in a previous video, what can happen is some of the bones stay locked or they're not moving the way they should. So there's tension in the system. One of the bones that can be locked is a very important bone which is found in this area called the sphenoid bone. And the sphenoid bone kind of looks like a bat. And it goes all the way behind the eyes, and it has articulation with several of the other bones. It's a very important bone. So when the cranial system is in tension because it got disorganized, it got caught off guard and hasn't come out of it, which is what we correct in neural organization technique, the body stays locked in this defensive system with the tight jaw, but the cranial bones stay locked, and this bone particularly does not move so easily, which creates tension on the brain. It also acts as a pumping action to pump fluid around the brain and spinal cord, as well as pumping within the crevices of the brain. So you can imagine if a person's nervous system is relaxed and pumping the way it's supposed to, we have proper nourishment of the brain and spinal cord, so our lights feel turned on. But if we're stuck in this tension in the background, you can see people sometimes where it looks like their eyes are red, or they always have tension going on in their temples. And when they talk to you, they sometimes feel like they're straining. You can usually ask them, do you have headaches? Or sometimes they'll have trouble with like night driving because the lights trigger them off, or bright lights, or even sometimes sounds. They're just already on a state of tension, and now these external stimuli can take them over the edge. This is where we call them migraine headaches, but really the way we look at it is it's just a very tight and armed system. Therefore, we need to do reorganization of the nervous system. So that's usually where migraine headaches come in. And then people will also say that, oh, I get triggered by red wine, or I get triggered by certain food stimulus. Well, if you also understand the concept of neural organization technique, they're already up in defense. So that means the body is drawing away power from the digestion and the hormonal system. So these systems are already weakened. And now an external stimuli, such as red wine or cheese or whatever it is, fatigues or stresses out the digestive system or the hormonal system even more, and the chain breaks at its weakest link, so to speak. So the defense system goes off. It's already in defense, and now this external stimuli, it says, now I've got to deal with red wine or cheese, and that's just too much. And then the headache starts. So this is how we look at it. And in order to get the body less sensitive in the digestive triggers or the hormonal system, the theory of neural organization technique is first get them out of defense. Then the body's wisdom says, now I can turn up the digestion and hormone system. Over my years, I've worked on many cases of headaches and cleared them up. And as a chiropractor, we were taught adjust the atlas, adjust the upper cervical vertebra, the vertebra in the neck, which gets some results, but if it keeps coming back, if the problem keeps coming back, there's a reason, and this may help to explain why. Now, on the topic of depression, if this sphenoid bone is locked, normally it's supposed to pump around and move. And inside the sphenoid bone is your master hormonal gland, which is called the Pituitary Gland. It sits cupped inside a protective area of the sphenoid. And what we believe happens is when the sphenoid moves, there's a pumping-like action, and that sort of milks this pituitary gland and keeps the pulsation going. So we have our master hormonal gland properly controlling our hormonal function in the jungle of life. This is also in metaphysics called the third eye, because it seems to have our connection to our higher level of being. So we feel good. And if this sphenoid bone is locked from an old cranial trauma, and the body's saying, I cannot let this go, I have to stay ready for the next trauma, so it would be great if somebody would disarm me and reset me, which again is what we do in neural organization technique. But now the body is staying in this tension, and so the pump is not fully working. So as the years progress, this pituitary gland is not getting its electrical life force. So it starts to wither, and then we start to feel less connected. And that's in the early years. They might just feel, oh, I feel like, I call this the stranger in a strange land phenomenon. They just don't feel like they belong to their friends, or they're in a group, but they just don't feel connected. And as it goes on later, we have little labels, oh, you're such a loner, oh, you're such a this, but then it continues further, and they're at home always feeling like, I want to do this, or I have passion for this, I love this, but the lights are just turned down. And then they go to medications, or they go to external corrections again, change their external, whether it's drinking and drugs, where it's going out and socializing, but then when you're on your own, you're back in feeling like a loner, or feeling this depression. And nobody wants to label that or talk about this. But sometimes it's just the lights are turned down because this whole intricate, intelligent, beautiful pump is just not been reactivated because they got hit when they were a child, they fell, which is normal in life. So this is one of the things many people benefit by getting a neural organization technique correction.